Right, so we're in the final part of our three-part series dealing with the blood, chapter 18. And we're going to look at the leukocytes. Here are the objectives or outcomes that I'm hoping you guys will take from this particular chapter, the remaining part of this chapter, such as if a person has a deficiency or an excess of leukocytes, what types of disease will they have, what are the causes, what are the effects, what's the appearance and the relative abundance of the leukocytes, as well as the function of the leukocytes. Now, leukocytes, or white blood cells, are the least abundant form of elements, but are typical in protection against infectious microorganisms and other pathogens. They are easily recognized because, when stained, they have conspicuous light violet to dark purple nuclei. They spend only a few hours in the bloodstream, then they migrate through the capillary walls to the extravascular connective tissues. Leukocytes retain their organelles through life and show a complex internal structure. Among these organelles are the usual protein synthesis elements. What are they? Nucleus, rough endoplasmic reticulum, ribosomes, and the Golgi apparatus. Now, some synthesized proteins are packaged into lysosomes other than organelles, which appear as conspicuous distinguishing cytoplasmic granules. Now, all white blood cells have lysosomes called nonspecific granules. They're either and they're inconspicuous, so that they appear clear in the cytoplasm, and they absorb the blue and violet dyes of stains. The granules have specific granules that contain enzymes and other chemicals employed in defense against pathogens. Now, there are approximately 5 kinds of leukocytes, and they fall underneath these 2 categories, like I mentioned in the very first video. We have granulocytes and agranulocytes. Under the granulocytes, we have the first 3, which are neutrophils, eosinophils, and basophils. The neutrophils, they're barely visible granulites in the cytoplasm, and they're 3 to 5 lobed nucleus. The eosinophils, they're large rosy orange granules, and they have a bi-lobed nucleus. The basophils, they're large, abundant violet granules with an obscure and a large S-shaped nucleus. The agranules, they just have the agranulocytes. There's 2 underneath that category. They're the lymphocytes and the monocytes. The lymphocytes, the variable amounts of bluish cytoplasm. They're oval or might be a round shape, and the uniform dark violet nucleus. The monocytes, they're the largest white blood cells. They are usually oval shape, maybe shaped like a kidney or a horseshoe shaped nucleus. So when we look at the first 3 from the granulocytes, let's look at the neutrophils. I already said they're the most abundant, so they have an increased number of bacterial infections. Now, the nucleus, already said, is visibly clear and consists of 3 to 5 lobes connected by the slender strands, and the mature neutrophils. Now, the young neutrophils have an undivided band-shaped nucleus and are called band cells or stab cells. The neutrophils are also called the polymorphonucleate leukocytes because of their varied nuclear shape. The cytoplasm contains fine reddish to violet specific granules. The neutrophils are so named because the granules take up stains at a pH of 7. And then, of course, their count rises in response to bacterial infections. The eosinophils, number 2, they make up about 2% to 4% of the white blood cell total, typically numbering about 170 cells, microliters, but this count fluctuates greatly. Their count rises in allergies, will rise when there's any type of allergies, a parasitic infection, collagen disease, and diseases of the spleen and the central nervous system. They're abundant in mucous membranes of the respiratory, digestive, and the lower urinary tracts. Now, the eosinophil nucleus, they usually have two large lobes connected by a thin strand, and the cytoplasm has an abundance of coarse, rosy to yellow colored specific granules. They also secrete chemicals that weaken and destroy parasites such as the hookworm or the tapeworm, and also phagocytize and dispose of the inflammatory chemicals, allergens, and any antigen antibody complexes. The third one is our basophils, and they are the rarest of the white blood cells and of all the formed elements. And they only constitute about 0.5% to 1% of the white blood cell total, and typically numbering about 40 cells per microliter. Now, they contain an abundance of very coarse, dark violet specific granules that hide the nucleus, which is large, pale, and typically S or U shaped. Now, basophils, they secrete histamine and heparin. Now, histamine is a vasodilator that also makes blood vessels more permeable, and the heparin is an anticoagulant. The basophils also release chemicals to attack the eosinophils and neutrophils to an infected site. So we're going to look at the two agranulocytes. So here is the very first one, which is our lipocytes. Our lipocytes, they are second in the neutrophils in abundance, numbering about 2,200 cells per microliter and making up to 25 to 33% of the white blood cell count. They range in size from smaller than red blood cells to 2.5 times as large. They are sometimes classified into 3 size classes. Our medium and large lymphocytes are usually seen in fibrous connective tissues and only occasionally in the blood. Their nucleus is round, it's sometimes oval or slightly dimpled, and usually stains dark violet, which you see here. Now, in small lymphocytes, it fills nearly the entire cell. Small lymphocytes are sometimes difficult to distinguish from the basophils, but basophils are conspicuously graining and also lack a rim of clear cytoplasm. So this is that clear cytoplasm. Okay. And large lymphocytes are sometimes difficult to distinguish from the monocytes. Now here are monocytes. Monocytes, they number about 460 cells per microliter and comprise about 3% to 8% of the white blood count. They are the largest white blood cells, often 2 or 3 times the diameter of a red blood cell. Now the nucleus is large and clearly visible, often a relatively light violet and typically oval, kidney-shaped, or horseshoe shape. So here's one here. This would be our horseshoe-shaped nucleus in here. Now the cytoplasm is abundant and contains sparse fine granules. In slide preparations, the monocyte often assume sharply angular to spiky shapes. Monocyte count rises in inflammation of viral infections. They will leave the bloodstream and transform into these large tissue cells called the macrophages, which phagocytize dead or dying hosts and foreign cells, chemicals, and other microorganisms and foreign matter. They also display foreign antigen fragments and their surfaces to alert the immune system, and are thus called antigen presenting cells, or APCs. Now, in the life cycle of a leukocyte, leukopoiesis, which is the formation of white blood cells, it begins with those same hemopoietic stem cells as in the erythropoieses. Now some HSCs, which is our hemopoietic stem cells, which I will be referring to, they differentiate into distinct types of CFUs, which is our colony forming units, and then they go on to produce like 3 cell lines, each of them now irreversibly committed. We have our myeloblasts, we have our monoblasts, and we have our lymphoblasts. Our myeloblasts, they ultimately differentiate into 3 types of granules, which are our neutrophils and our eosinophils and our basophils. Then our monoblasts, they're the ones that form the monocytes, and our lymphoblasts give rise to all forms of lymphocytes. Now T lymphocytes, they complete the development in the thymus, and then others will be rerouted once they're mature. They would go to like the spleen, the lymph nodes, and other lymphoid organs and tissues. So let's look at this diagram. We have this figure 1818, and this will show you the various myelocytes, myeloblasts, monoblast, and the lymphoblast. So here we have our lymphoblast here, and this one will eventually give rise to our remaining lymphocytes, the B lymphocyte, T lymphocyte, and our NK lymphocyte. Our monocyte, our monoblasts, they're going to ultimately form our monocyte. And our myeloblasts, which are, they form 3 of them, they eventually, through the process, will give us our eosinophils, our basophils, and our neutrophils. So you see the distinction. These 3 are formed by our myelocyte. Our monocyte is formed from the monoblast, and our remaining 3 are formed from the lymphoblast. Now, circulating lymphocytes do not stay in the blood for long. Our granulocytes, they accumulate for 4 to 8 hours, then migrate to the tissues where they live another 4 to 5 days. The monocytes, they migrate for 10 20 hours, they migrate into the tissues and they transform into macrophages, which can live for a few years. Lymphocytes survive from a few weeks to decades. They leave the bloodstream for tissues and eventually enter the lymphocyte system, which takes them back to the bloodstream. Now, when lymphocytes die, they are generally phagocytized and digested by the macrophages. Okay. We have lymphocyte disorders. Lymphocyte disorders, they include counts that are too high or too low, as well as cancer lymphatic tissue. A total white blood count of less than the normal range of 5,000 to 10,000 white blood cells per microliter is called leukopenia. So someone having a white blood count less than 5,000 is considered to be leukopenia, and it can result in an elevated risk of infection and cancer. It is seen in lead, arsenic, and mercury poison, radiation sickness, and certain infectious diseases, including AIDS. Now, if a person has a white blood cell count higher than normal, higher than the 10,000 white blood cell per microliter, is considered to be leukocytosis. It is usually an indication of infection, allergy, or any other type of, or maybe other diseases. Now, a differential white blood count is it identifies what percentage of the total white blood count consists of each type of leukocyte. Let's take a look at the complete blood count. I think I moved my slides around a little bit. Okay, well, let's just look at the total blood count. Look at total blood count. We're looking at the hematocrit. So let me go back just a little bit. When we look at the complete blood count, this is the most common clinical procedure that's used in both routine and physical examinations and the diagnosis of diseases. Now, when they obtain a CBC, which is a blood count, a complete blood count, they're able to determine the number of RBCs or WBCs and platelets per microliter of blood, as well as the relative numbers of each white blood cell. And those are considered to be the differential white blood count. They look at the hematocrit, look at the hemoglobin concentrations, and the various RBC indices such as RBC size and hemoglobin concentration per RBC. So let's get back to my diseases or disorders. Mine is this other one is called leukemia. Leukemia is a cancer. I know a lot of people have heard of that. Of course you have. It's a cancer of the hematopoietic tissues that usually produces an extraordinarily high number of circulating leukocytes and precursors. The myeloid leukemia is marked by unusual granulocyte production. The lymphoid leukemia is uncontrolled lymphocyte or monocyte production. We have acute leukemia of any type appears suddenly, progresses rapidly, and causes death within a few months without treatment.